This ointment is used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations like diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin, reducing itching and flaking. Some ingredients are also used to protect the skin from irritation, while others work by forming an oily layer on the skin to trap water. This ointment also contains humectants to draw water into the skin, as well as ingredients to soften the top layer of skin cells and help dead skin cells fall off. It leaves the skin feeling smoother and softer. Make sure to use this product as directed, and some products may need to be primed before use. Be sure to follow all the directions on the product package, and if you have any questions, ask your doctor or pharmacist. Some products may need to be shaken before use, so be sure to check the label to see if this applies to your product. Apply the ointment to the affected areas of your skin as needed or as directed on the label or by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use the product every time you wash your hands, applying it throughout the day. If you are using this product to treat diaper rash, make sure to clean the diaper area well before use and allow it to dry before applying the ointment. For radiation skin burns, check with radiation personnel to see if your brand can be applied before radiation therapy. Remember to follow all the directions on the label for proper use and apply to the skin only. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise. Also, be sure to check the label for any directions about areas or types of skin where you should not apply the ointment, and consult your doctor or pharmacist for more details. Use this ointment regularly to get the most benefit from it, and apply it after bathing or showering while the skin is still damp. For very dry skin, your doctor may instruct you to soak the area before using the product. Be aware that long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. When using Aquagard 41% topical ointment in packet, it is important to be aware of potential side effects. While most people can use this medication safely with no side effects, some may experience burning, stinging, redness, or irritation. If any of these effects persist or worsen, it is important to consult with your doctor or pharmacist. If your doctor has prescribed this medication for you, it is because they have determined that the benefits outweigh the potential risks of side effects. However, it is still important to be aware of any serious side effects that may occur. Contact your doctor right away if you experience unusual changes in the skin, signs of skin infection, or any symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. It is important to note that this is not a complete list of possible side effects, and if you experience any other effects not listed, it is important to consult with your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Aquagard 41% topical ointment in packet, make sure to inform your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have any skin cuts, infections, or sores, it's best to consult your doctor or pharmacist before using this product. Some ingredients in this product, such as preservatives or fragrance, may make you more sensitive to the sun. Make sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may suggest limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you get sunburned or experience skin blisters/redness, be sure to tell your doctor right away. For those with acne-prone skin, some products may worsen acne. Look for the word non-comedogenic on the label, which means the product will not clog pores. Additionally, some products may stain or discolor clothing, so it's best to ask your doctor or pharmacist for more details. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this product, as well as consulting with your doctor before breastfeeding, especially if you are applying this product to the breast area. When using Aquagard 41% topical ointment in packet, it's important to be aware of how it may interact with other medications you are taking. This can affect how your medications work and increase your risk for serious side effects. Remember to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with a healthcare professional before making any changes to your medication routine. This will ensure the best possible outcome for your treatment. If this medication is ingested, it can be harmful. In case of an overdose with severe symptoms like loss of consciousness or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. U.S. residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. To help prevent dry skin, it's important to use lukewarm water for bathing, limit baths/showers to every 1 to 2 days, keep baths/showers short, and use a humidifier in dry air. There are various emollient products available, including those with fragrance or other ingredients that some individuals may be sensitive to. These products come in different forms like oils, creams, lotions, or sprays. It's best to consult with your doctor or pharmacist to find the right product for you. If you are using Aquagard 41% topical ointment on a regular schedule and miss a dose, use it as soon as you remember. Do not use more product or use it more often than directed to catch up. It's important to follow the recommended dosage and frequency to avoid any potential side effects. Make sure to check the storage information printed on the package, and if you have any questions, ask your pharmacist. Keep all medications away from children and pets. Avoid storing the foam canister near high heat or an open flame, as it is under pressure. Do not puncture or burn the canister. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.